Back with you now on Wave Listens Live. We have Dr. Doug Kane joining us now from the Cornerstone Wellness Center. And Doug, I know you brought Doris, your mother, along perfect after Mother's Day.
Absolutely.
Did you guys have a good Mother's Day?
Yes, we did.
He takes care of you, right? like every good son should. Want to talk a bit, the folks who have seen you before know that you're an expert when it comes to neuropathy. So we really want to hit that today and talk about maybe if somebody's experiencing this for the first time, some of the things they need to know.
Sure. So neuropathy in its simple forms just means that the nerves aren't working properly. So they don't send normal sensations to the brain. It can be extreme pain. It can be hot or cold type issues. It can be like pins and needles, or some people will feel like they've got ants crawling on their skin. And then on the other side of that coin is this total lack of any kind of sensation, which we would call numbness. And so that's generally how it starts. Oftentimes people have dealt with it for a little while before they become diagnosed, and they'll usually think that there's a wrinkle in their sock, or maybe there's a pebble in their shoe. But then as that advances over the months or years, they realize that this is what's called peripheral neuropathy.
And Dr. Kane, obviously you specialize in this, but I want to go back to the very first case for you, which was your mother Doris, and what some of those early moments were like when you realized this was a problem that she needed addressing.
Yeah. So one of the biggest problems in treating peripheral neuropathy is we're all taught in school there's nothing you can do for peripheral neuropathy. And so that was my experience as well. And, you know, Mom was developing these symptoms and was diagnosed with this and called me one day and said, you know, this is what I have. Is there anything you can do for this? And my answer was no. Because, you know, that's what I was taught. And then I thought, well, you know, it has been a while since I've been in school. Let's see if there's anything that's new that's developed. And so I found a group that uses this protocol. I learned their system. We used that for Mom and saw what kind of results that she got and how it changed her quality of life. And I thought, you know, this is what we need to do. So I went to a lot more schooling with it. I'm actually one of the only doctors that's board certified in neuropathy and intractable pain in this region of the country. There's just a handful of us across the nation. It's a fairly new board certification. But so we've been able to bring this back to the community and help a lot of other people.
Yeah, Mrs. Kane, to go back to the experience that you had, what was it like before you started getting treatment? Can you talk to folks if maybe they're at home experiencing something that they think is close to what you did? What was it like?
It was like I was walking on hot coals. The bottom of my feet burned all the time, and especially when I go to bed at night and I just can't go to sleep. I couldn't go to sleep. So I decided to try putting my feet in cold water.
Did it help?
And it helped enough that I could go to sleep.
Can you talk about how much of a disruption, outside of just the sleep, having neuropathy can be in your daily life?
Well, it's just it's constantly hot. I could not wear tennis shoes and socks. I just couldn't. Even in the wintertime, I'd go walk around the house without shoes. And so I have gone out into the garage in the wintertime and walk around on the cold concrete.
You were doing what you had to do.
Yes, that was the only thing that would calm them down.
And how are you feeling now?
Much, much better.
Which we're, of course, glad to hear. And
yes.
and as we come back to your son here, as the person who was able to fix this, what are those moments like for you, whether it's your first patient or the next one you see, when you're able to make a change in somebody's life?
It's just, you know, it's humbling. It's, but as somebody that's always been involved in healthcare, that's the reason why, you know, we go into that. I mean, she's my mom. She's the reason I'm here for a lot of reasons. But, you know, I started off as a chiropractic patient as a 15-year-old. I had one solid headache for about 2.5 months. Oof. And it was kind of assumed, it was before MRI was readily available, but that I had a brain tumor. And so Mom took me to a chiropractor, and just instantly I felt better, and I thought, well, this is what I want to do. So being able to see people get well, you know, we just celebrated our 31st anniversary in practice. You kind of take that for granted after that long a time period. You expect people to get well, but to work with this group of people that has such profound interruptions in their quality of life, their activities of daily living, you know, they don't get to play with their grandkids, they don't want to travel, they don't want to shop, they hurt, so they just want to stay off of their feet, and it just absolutely wrecks their quality of life. So to be able to give that back to somebody, that's pretty neat.
I can imagine, and if we go back to the why, to the what's causing this, if I'm sitting at home and I say this sounds like exactly what I have going on, first and foremost, what's causing it?
So the common denominator in almost all causes of neuropathy is loss of blood flow at the cellular level. And what I mean by that is you've got large vessels, you've got medium-sized vessels. What we're talking about is the capillaries, the very tiniest vessels. And so we're not getting blood flow to those nerve cells. And what that results in is the nerve cells itself become, they're starving, and they can't get the oxygen. So they're starving and they're suffocating. And so obviously those are not good things. You can see the infrared pictures that we have on the screen there. If you see the patient on the left side, or excuse me, the right side of the screen, you can see the legs and the feet are white and red. White hot, red hot. We've all heard those phrases. That's good. That shows good circulation. The patient on the opposite side of the screen, you can see we're seeing a lot of yellows, a lot of blues and purples in their feet. This is somebody that doesn't have good blood flow. The great news is this is the same person pre and post treatment, 90 days difference. We were able to restore that blood flow. The nerves can heal, and then you can get your normal sensation back.
Which means if somebody's calling you today, maybe by end of summer, we're starting to look at the after picture instead of the before. So we got about 45 seconds left. Best way to schedule a consultation. I'm at home and I say, I need this. I want to see someone on your team.
Call the number on the phone. My staff is standing by right now. We also have the website listed. If you want to see some other patients give their testimonies of how they've been helped, we have a neuropathy tab if you go to that website, and you can drop down and you can see testimonies of several patients that have gone through our process. But we will get you in for a brief examination so we know exactly what's going on and can get you on the road to recovery.
Dr. Doug Kane, thank you so much for the work you do and for being with us and bringing Doris in here today.
Thank you for having me.
Thanks to all of you for joining us here for another edition of Wave Listens Live. We'll see you back here tomorrow.